Hi guys, Dr. Joe Rangel. We're going to talk about stress today. And stress is something we've all got. You guys have got it, right? You're in school right now. I've got it. I've got 6 different classes across a couple different universities, plus another job working in law enforcement. Everyone's got stress. We've all got stress. Talk a little bit about what stress actually is, and some of the theories about what we can do about stress. First off, number one, stress kills. Like you know that. You've heard that before, right? That's not a surprise. Stress kills. Stress has been implicated in everything from heart disease to survivability of cancer to your ability to heal from injuries you get, to mental disorders, to onset of burnout, which isn't technically considered a mental disorder, but it's still a bad thing that happens. Stress is awful, right? Drug abuse, alcoholism, domestic violence, getting arrested for other things that happen. Yeah, stress is terrible. We don't like stress. Okay. Here's the thing. Your body, or your brain anyway, has evolved quite a bit since it first became conscious and cognizant over the millennia. But one part of it hasn't really changed all that much. And that is the autonomic nervous system, not automatic, autonomic. And that's the part of your brain and your nervous system that triggers when something happens. It is automatic, actually. But your brain's job is to keep you alive. And when your ancestors were out in the forest or in the deserts or in the jungles or wherever they came from, and they encountered a predator of some form, right? A big giant bear comes out to eat them. Your autonomic nervous system kicks in right away and causes a few things to happen, right? And you've heard this before, right? You know, fight or flight. You've heard this. Actually, currently we don't just refer to it as fight or flight. It's actually fight, flight, or freeze. But whatever, it's the same thing, right? When fight or flight kicks in, the recipient of the fight or flight stimulus is either going to do exactly that. They're going to fight whatever threat has appeared, or they're going to flight, which is to run away. Or we've added freeze. Sometimes they just vapor lock and lock up like a possum. Right? What's going on inside your body is your brain has activated the limbic system in your body, and your cortisol levels, that's a hormone, it's called the stress hormone, spike. Your adrenaline levels spike. And what this has on, and as an effect on you, is it causes your visual perception to narrow. Your peripheral vision goes down about 68 to 78%. That's a lot. Okay, so you become very focused, tunnel vision. All the blood in your body starts moving towards the core of your body, away from your limbs, which is why in a very frightening or traumatic situation, you may feel some tingling in your arms and legs and feel kind of like you can't grip anything. That's because everything's coming in to protect the vital organs, right? Heart rate shoots up through the roof, right? As we already talked about, the adrenaline is going nuts. So it's causing the nerves and the muscles to fire so that you're ready to run. Your fast twitch muscle fibers, get ready to activate. The whole system's turned on to go into emergency mode. Okay, your hearing actually goes down. Like I said, your vision centers in. Your sense of smell kind of shuts off. Right, your body is putting all resources to pulling all systems away from all other systems your body has, and it's putting them right into your survival stuff. Okay, I guess that makes sense, right? I mean, it must have. It's been working for a very long time. Here's the problem. Like I said, your brain, that part of your brain has not evolved much since we were dealing with bears jumping at us out of the woods or jaguars in the jungle, right? So when it detects a threat, that's what it does. And a threat might be you getting called into your boss's office. A threat might be you having an argument with your boyfriend or girlfriend. A threat might be you experiencing some form of trauma. All of these things activate the fight, flight, or freeze response. And They are all stress. You see, all trauma is extreme stress, right? And that isn't to belittle or diminish anyone who's had trauma. You know, people with post-traumatic stress disorder have experienced a life-threatening trauma or a bunch of traumas, right? Ongoing over several times, they've experienced a life-threatening trauma, which has caused a massive stress response in their body. And their body went into fight or flight during the trauma, just like it's supposed to. And whenever they get reminded of the trauma triggers, the body goes back into fight or flight. This is why we say people with post-traumatic stress disorder have these triggers which cause these responses in them, because their body is going into fight or flight, with just the trigger being there, no longer the trauma. Okay. This isn't the lecture on the disorders, but that's how post-traumatic stress disorder, in a very brief nutshell, works. So when you are like, oh my God, I've got 3 term papers due, I've got a test, I've got to watch this guy's stupid video lectures, and you've got a time limit, and your body is starting to say, you're starting to feel like the heart palpitations, you're not being able to sleep at night, you've got a headache. This is fight or flight. Your body has perceived a threat, and now it's interpreting it and saying, okay, we've got a threat. It doesn't know that the threat is on paper. It just knows that there's a threat. And that's what stress is. Okay? There's a theory of stress called the global stress theory. And it's interesting because it comes from ancient Greece, and then ancient Rome, and a group of philosophers called the Stoics. And then later on, it developed into a type of psychological therapy called cognitive behavioral therapy, which is one of the most popular and most common types of therapy there is out there, scientifically studied and clinically evaluated. And so the global theory of stress basically says this: the stimulus, the threat, the stress, whatever, occurs, and it is perceived by you through your ears, through your eyes, through your nose, through your mouth, through whatever, through your touch. You've perceived it somehow. And through those senses, you are now going to flip it and change it and add meaning to it. And in so doing, you are going to create the stress in your body. So basically the idea is that there's global stress that occurs, but the perceived stress happens when that stress hits you, and then you decide how you want to interpret it. And this goes back to a cognitive behavioral idea that there's things we can control, things we can't control, and we only should focus on what we can control, and blah blah blah. But here's the idea: when we talk about things like meditation, we talk about things like mindfulness, we talk about all these different things out there that are used to try and beat stress. What they all come down to is this basic idea: you can't control what happens to you, but with practice, you can control your response to it. Now, we can see this happen basically daily with firefighters, law enforcement officers, and soldiers across the United States of America. These are people who are trained, and they go through things called stress inoculation in their academies and training programs and their boot camps, to expose them to the sound of gunfire, to expose them to visual images that are disturbing, to expose them to people screaming at them, yelling at them, to bad situations, to dangerous situations, to fires, to those kind of things, to get them used to it so that they can learn to see the stress and say, okay, I've been here before, I've seen this before, I know how this is going to work, and they're able to rationalize it and control it before the fight or flight system kicks in. It's not a perfect system, of course. Cops, firefighters, soldiers, they're all very susceptible to PTSD and all the other stress-related maladies that you can get, but that's what the stress inoculation training is for. So that's the global stress versus the perceived stress. All right? All right, guys. I'm Dr. Joe Rangel. Thanks for watching.